Hi, we're Gemma and Michelle, the Nutritional Care Nurses at Birmingham Children's Hospital, and we're here to support you, your child and the nurses on the ward in caring for your child's new gastrostomy.
In this video, we will discuss and demonstrate with our friend Jake how to care for your gastrostomy. You should always wash your hands before and after handling your child's gastrostomy. Before using the gastrostomy, you must always check the tube is sitting in the correct position. You should check the external graduation markings on the tube to ensure the length marking remains the same as when it was inserted. You can also aspirate back some stomach content with a syringe and test on a pH strip for an acidic reaction of 5.5 or below to confirm the correct position, like you do with your nasogastric tube.
If anything looks odd or painful when you use your child's gastrostomy, it is important that you stop use and you seek advice from the health professional that usually advises you at home. This could be your community nurse, your GP or your nutritional care nurse. When accessing the port to attach your syringe or feed set, it is important to hold the feeding port to stop the tube from twisting. You may also need to kink the tube if it doesn't have a clamp to prevent any backflow when opening the port. You will need to flush your child's gastrostomy tube with at least 5 millilitres of water to prevent the tube from becoming blocked. Your child's nurse or dietitian should be able to advise how much water you should need to flush with. It is important to flush the gastrostomy before and after each use. If your child is on a continuous feed, we'd recommend that you flush at least 3 times a day. When flushing the tube, the water should flow easily. There should be no leakage, redness or pain when flushing. If the gastrostomy is blocked, do not force to unblock it. You may attempt to unblock it by trying to flush with some warm water, carbonated or soda water. Push the syringe plunger backwards and forwards. If you can see or feel the blockage, it may help to massage the tube between your fingers to help clear it. You may need to leave the tube 15 minutes and then flush with water again. If the tube remains blocked, please contact your child's healthcare professional that supports you at home. If you are happy that your tube has been flushed and is working well and your child is due a feed, you can attach your feeding set to the port. When giving medicines via the gastrostomy, it is important to use a liquid form. If no liquid is available and you need to crush tablets, ensure that they are crushed well to a fine powder and mixed with the appropriate solution. It is important to never mix your medicines together or to add them to feed, as this can block the tube, and it is important to make sure that the tube is flushed well before and after and in between each medication. If your medication leaves a sticky residue on the port or on the tube, you may need to give it a clean to stop the cap from sticking. Air can become trapped in the stomach. If your child is uncomfortable, you may need to release this air through the tube. This is known as venting. Some children may need venting before each feed, others just as and when needed. To vent the tube, remove the plunger from a 50 or 60 ml syringe and attach to the tube. Hold upright about the level of your child's stomach. This will allow the air to freely pass up and out the tube. Sometimes stomach content may flow into the syringe, but this can drain back down. You may need to replace the plunger on the syringe before you disconnect.